Okay, hi everybody. This is for the week three. This is week three lecture PowerPoint for OT 300. So it's week three, the lecture PowerPoint. The big things from this week are the anatomy and the function of the shoulder and the elbow. Okay, get this working here. So this is part one. Just want to talk a little about the readings, the story readings. These stories are based on clients of mine that I had in the past, real people. And they kind of give us good examples to kind of apply what we're talking about versus just, talking about it and reading about it in the book. Kind of brings it to life a little bit, kind of an OT kind of context. Something that was a big part of this story was the use of adaptive devices by Francis. The therapist in the story made some of the devices, and Francis was using a lot of the devices to help him get dressed and with different daily activities. You'll learn more about these devices, as you work your way through the program. The ones that he was using, I can think off the top of my head, a lot in the story was the sock aid. This is a device helping you getting your socks on if you can't bend over. He had a lot of issues with bending over, and you'll see that commonly with a lot of our older clients. The low back is sore, they can't bend over, too stiff, too obese, whatever the reason is, or they're not allowed to bend over because of a fractured hip. Bending over to dress your feet, to start your dressing, can be very challenging for a lot of folks. So some of the devices that were used for that in the story with the sock aid, like I said, elastic laces. The deal with elastic laces is they just stay tied. You don't have to keep bending down to tie and untie them, and they stretch, kind of turn your shoe into a loafer. I think he had a reacher, which is just a thing to pick up things off the floor. And there were things around his toilet. He put in the grab bars to help him get up off the toilet. And I think there might have been some kind of riser on the toilet because it was low. I think there was also maybe a fishing string around his zipper for his fly, I think, to make it easier with arthritis to loop your fingers through it and do it. We'll do this at some point in the lab. You'll get to see it, how to use this before you start using it with clients. How is Francis a product of his generation? It's very important as a therapist to kind of understand where your clients are coming from, how they kind of see the world. And it's very important to kind of slip into their world, and this is kind of getting to the next question, but not really judge them so much or think in terms of your opinions of things or things that they do or may not do. We all have opinions. We all are very judgmental of other people and ourselves. It's just human nature. But as a therapist, you need to really kind of put that to the side and really kind of live in live in your client's world. And the reason for this is so you can see what's important to them. You can get the really ideal kind of therapy goals and be a lot more effective as a therapist, without a doubt. And again, that's something we'll talk more about throughout the program. So it kind of gets at this question: how is Francis a product of his generation? I would answer that question by saying a lot of big events shaped who he was. Definitely the war shaped who he was. But I would say even more so the divorce, his wife leaving him with his child there, losing his child when he was very young. Those are the big two. I think you could say he was a Depression era kind of individual. A lot of poverty, rural isolation, worked in a mill, that sort of lifestyle. Those things all kind of influenced the person that he became. How does the OT approach Francis in terms of judging his life choices? Again, it gets back to before, like his alcohol abuse, the fact that he kind of abandoned his family. It's very important as a therapist not to judge that and just to kind of go again where he's from. And the therapist in the story was not judgmental. He tried to see Francis as Francis saw things. How does the OT's plan of care with Francis change and why? It changes as the therapist gets to know him more. The more he talks to him, the more they kind of connect and develop a relationship, develop a rapport. He really finds out what's really important, what's really meaningful to Francis. And this is a huge part of being an occupational therapist, finding out what is meaningful, what is important to your client. To Francis, the furniture was meaningful. Sanding the furniture, staining the furniture, he loved that. It was an important activity to him. So that's how the therapist kind of changed his plan to incorporate things that are meaningful to him, get him using his shoulder to sand and to work the furniture. How was the OT's approach different from the PT's? PT was very much into exercise and the rehab focus, whereas the OT was thinking more, okay, what's important to Francis? What does he want me to do versus what I want to do? You really need to kind of go where your clients want you to go and kind of find that middle ground. So Francis, I think he kind of talked about the pain. He wanted to get the pain knocked down before he did anything. And they did that with the ultrasound machine, which you'll learn about. And then he wanted to be able to do those little things, stay out of the hospital. What did that mean? Getting dressed by himself, cooking by himself. And this is where the therapist kind of helped him out. And that's kind of how it made a difference to therapists. I kind of got that buy-in and why it worked as a relationship between the two of them. Okay, and these are your lecture questions for this week. So these are going to be on the quiz on Monday, 9/14. I think that should say week 3 lecture questions. Sorry about that. So these are the week 3 lecture questions, which are going to be on the quiz that you have coming right up, 9/14. So along with the anatomy listed on Canvas, I always go back to that list on Canvas and I'll tell you which anatomy you need to know for which quiz. So all 6 of these questions, potentially one of them, probably just one of these questions, will be on that quiz. And we'll answer these questions today in this PowerPoint. Okay, so the first thing we're going into here is around muscle testing, manual muscle testing, and just kind of going through these. These are basic principles. This is from the reading. All this stuff you're going to need to know for your midterm exam, even if it's not one of the lecture questions. Muscle strength consists of strength and endurance. Endurance in a lot of cases is more important than strength in a lot of the clients we're working with. Important clues to impaired function. What causes muscle weakness? A lot of things cause muscle weakness. Disuse causes muscle weakness. Classically, lying in a hospital bed. If you're in a hospital bed for days at a time, you're going to get weak from that. Neurological, we'll talk more about this, like a stroke, multiple sclerosis, damage to your nerves. Your nerves control your muscles. That'll cause weakness, muscle weakness. Trauma. If somebody fractures their shoulder, the muscles instantly atrophy. They instantly shrink and become weak. So fracture trauma can cause muscle weakness. Age can cause muscle weakness. When you get older, you naturally start to get weaker. Definitely had something to do with Francis. The age, as he was getting older, he had natural weakness. He had disuse. He'd been in the hospital for a while. That caused weakness as well. Pain just by itself causes your muscles to be weak. Francis had pain, so he had weakness. Definitely different kinds of illnesses cause weakness. Again, being in a hospital can kind of knock you down, make you weak. Why do we need to measure muscle strength? What is the reason why we're going to spend so much time determining how to measure muscle strength in the manual muscle testing and that first practicum? It's how we show progress, how we show progress to patients. They can see they're getting stronger. As we can measure them, they're getting stronger. They can see that the rehab is working, starts to get them to buy into it, and they're motivated. Documentation, always need to document as a therapist to kind of prove what we're doing is working. You can prove what you're doing is working to the insurance by manual muscle testing. They've got better. They went from a 3 to a 5. They've gotten stronger. Shows you that your plan is working. You got to come up with a plan as a therapist. You put it into action, and then you test. Okay, my plan is working. These muscles that I wanted to get stronger are getting stronger. And it really drives that analysis of their movement, of their strength. It really drives your treatment decisions. If they're not getting stronger, you may have to rechange things, try something different. How do we assess muscle strength? There's a lot of ways to assess muscle strength. Just going to move this out of the way here. Different kinds of instruments that you'll learn: a pinch meter for fingers, dynamometer for hand grip. Observation is a big one a lot of therapists use. So as they're lifting their arm up, is it a fully clean, kind of pure movement, or are they compensating? Are they kind of cheating, twisting sideways to get their arm up, that sort of thing? The number of reps, how much resistance, how much weight can they take, how long did it take them to do it? A lot of times you'll get men or individuals, commonly men, who don't want to verbalize that you ask them, are you in pain, discomfort, is that too much? And they'll say no problem, and kind of power through it. But you look at their face, and they can see that they're straining, and they kind of think, okay, this is too much, we got to back it up. Their physical reaction, is their heart rate going up? Are they short of breath? Are they blanching, turning white, starting to perspire? Could be attuned to all these things as you watch them exercise. And then the manual muscle testing, which is what we're going to do ad nauseum in the labs. Muscle weakness, how do we address muscle weakness? Activities to address muscle weakness and endurance. Specific exercises, specific activities that target a particular muscle that we're trying to get, that missing link we talked about. Reducing the pain. Get rid of the pain, the strength just naturally comes back. So a lot of times therapists are focusing a lot on the pain for more than exercises, because they know they get rid of that pain, the strength will come back and they can do what they want to be able to do. Stretching can help with strength as well. If it's been shortened, you can lengthen that muscle, get a little strength back. Principles of manual muscle testing. We can isolate any motion, any muscle with it. It's a standardized technique. The insurances accept it. Doesn't need special equipment, just your hands and the knowledge. It's widely used by OTs, PTs, athletic trainers. Have those 5 grades. Need to know the gravity plane to go to assess progression. Contraindications of manual muscle testing. Most of these are common sense, but you need to know these. Again, this is all material you need to know from the midterm. Excessive pain. A lot of these things are subjective and it really varies on the situation, but excessive pain, you might not want to do it. Definitely a fracture. You may have to be very careful and not do it at all. Hernia. Spasticity. What do you mean by spasticity? We'll talk more about this. But somebody has had a stroke, neurological injury of sorts. Their muscle tone can be too tight. The muscles become too tight. You may have seen this with a kiddo with cerebral palsy. Too much spasticity can kind of throw off the grading scale. Excessive fatigue. There's certain conditions. Multiple sclerosis pops into mind. Chronic fatigue syndrome, where you're going to make everything worse by pushing and straining them, so you want to be careful about that. If they're too confused, you may not be able to do it. Certain cardiac conditions, restrictions. Classically, anything above your shoulders, above your shoulder height, anything above shoulder height with their arms is taxing on the heart. Be careful about that. Okay, so that's the end of part